Hello everyone, in this video we will see the anatomy of sacrum. So this is the sacrum bone. It is triangular in shape. As we can see the structure, this is triangular. This is the base of the sacrum and this is the apex. Apex is directed downwards. The apex is bearing a facet for articulation with the coccygeal vertebrae. Then this is the base, which is having in the middle, that is the body of S1 vertebrae. The anterior margin of this is very prominent, as we can see. This is very prominent. This is known as sacral promontory. Then these are the lateral surfaces known as ala of sacrum. This ala is smooth in its medial side and it is rough in its lateral part. Then posteriorly of this we can see the pedicles. These are the pedicles, which are very small, and these are the superior articular processes bearing the superior articular facets. These are articulating with the inferior articular process of L5 vertebrae. Then the surfaces of this bone, this is the pelvic surface, which is concave anteriorly, and this is the posterior surface or dorsal surface, which is rough on the posterior aspect. Then this is the lateral surface. As we can see, this is the lateral surface. This lateral surface is having the upper broad part and the lower thin part. This is narrow and this is broad. This broad part bears anteriorly this L-shaped auricular facet, which articulates with the auricular facet on the ilium and forms sacroiliac joint. And this is the posterior pitted part, which is rough due to the attachment of interosseous sacroiliac ligaments. Now we discuss the anterior surface. This anterior surface bears close to the midline. These are the transverse ridges, which are representing the fusion of the sacral vertebrae. These are representing the fibrocartilaginous intervertebral disc between the sacral vertebrae. After fusion, these forms these transverse ridges. Then we can see these are the foramina on the anterior surface. These are known as ventral sacral foramina, which are giving passage for ventral ramus of sacral spinal nerves. Then these are the lateral masses on the lateral aspect on the anterior surface. These are the bony bars between the ventral sacral foramina. These are representing the costal elements of the developing vertebrae. Then on the posterior side we can see this is the median sacral crest. This median sacral crest, these are formed by the fusion of all the spinous processes of the sacral vertebrae. In the lower part we can see this inverted U-shaped structure. This is known as sacral hiatus. Then lateral to it we can see these foramina known as dorsal sacral foramina. These are providing passage for the dorsal rami of the sacral spinal nerves. Medial to these foramina we can see these tubercles. These are known as intermediate sacral crest. These are formed by the fusion of inferior and superior articular processes of the sacral vertebrae. The inferior articular process of the S5 vertebrae is unfused, and this forms the sacral cornu. So this elevation is known as sacral cornu. Then lateral to the foramina we can see these tubercles again. These are the fused transverse processes of the sacral vertebrae. This is known as the lateral sacral crest. Then the lateral surface. So on the lateral surface we can see this upper broad part and this narrow lower part. This upper broad part is bearing this auricular facet, which is representing the costal element, and this articulates with the auricular surface or facet on the ilium and forms the sacroiliac joint. This pitted area represents the transverse element, and this narrow part, this is the area where we can see the formation of inferior sacral angle. Over here we can see the lateral border deviates medially at this point. This is known as inferior sacral angle. The anatomical position of this bone is when the vertebral canal, that is the sacral canal, is directed forwards and upwards. So this canal is directed forwards and upwards like this. This is the anatomical position of this bone. Then we have, in the case of lumbralization, the S1 vertebrae of the sacrum fuses with the lumbar vertebrae above. So in this sacrum we can see only 3 sacral foramina. Usually we have 4 sacral foramina by the fusion of 5 sacral vertebrae. But in the case of lumbralization, there is only fusion of 4 sacral vertebrae, as the S1 vertebrae fuses with the 5th lumbar vertebrae. So in this sacrum we only get 4 sacral vertebrae, and the sacral foramina, these are only 3 in number. So this is the case of lumbralization. And in the case of sacralization, as we can see in this bone, the first lumbar vertebrae fuses with the S1 vertebrae, and we got the 5 sacral foramina. So this is the case of sacralization. The normal sacral bone is having only 4 sacral foramina, as we can see in this bone. So this is all about the sacrum. I hope you understand well. Thanks for watching.